So, as you know, measles is caused by a virus of Paramyxoviridae family, characterized by fever, cough, running nose, and the characteristic maculopapular rash. So, it's a highly contagious, serious airborne disease that can lead to severe complications and death. And despite the availability of vaccination, measles remains a significant global public health concern, particularly in regions with a suboptimal vaccination coverage. And it was once thought to be under control, but it has resurged in the recent years, causing significant public health problem. And primarily, it affects the respiratory tract and lymphatic system, but the virus can also disseminate hematogenously, leading to systemic complications affecting the various organs. Though the ocular manifestations are less compared to the respiratory and neurological system, the spectrum of conjunctivitis, keratitis, uveitis, and retinitis, what is known as the measles-associated ocular complications, can have a significant visual concern. And of these, particular concern is the keratitis, which can lead to painful eye, photophobia, and decreased vision. The pathogenesis of measles in keratitis involves the direct viral invasion of the corneal epithelial cells and immune-mediated inflammation leading to ocular damage. So, studying the clinical features and incidence will definitely help in understanding the pathogenesis of this and clinical outcome of this particular condition. So, this is a cross-sectional observational study done in patients who were admitted with clinical features suggestive of measles with any symptoms or signs of ocular involvement from October 2023 to February 2024 in a secondary eye care center in Kerala. We took a detailed history including the general ocular symptoms, vaccination history and exposure history, demographic features were recorded, slit lamp examination was done, fluorescein staining was done to look for the different staining patterns, and laboratory investigations were carried out. This is one of our patients with the maculopapular rash and the conjunctivitis, and these are the different staining patterns. Coming to the results, we had 30 patients. The maximum number of patients were in the 20 to 40 years of age group. All patients had fever with rash followed by these symptoms. The most common symptom was redness in 83.3%, followed by foreign body sensation and blurred vision. Coming to the ocular signs, congestion was present in about 71%. Though cornea was not clear in only 66.7%, on FS staining, we found that about 74% had some or the other kind of staining. It included superficial punctate epithelial erosions to small punctate opacities to large punctate opacities and filaments. Coming to the lab parameters, almost all patients had less total number of leukocyte count with a lymphocytopenia. Coming to discussion, the most recent outbreak in India was reported in Maharashtra in 2017, where the children were the most affected group. But in my study, it was the immunocompetent adult patients. The conjunctival inflammation was almost comparable to the previous studies. The corneal involvement, you can see the rate of keratitis in the previous studies was about 50%, but in our study, about 74% had corneal involvement at least on fluorescein staining. And my patients were seen by two physicians. So 50% of the patients received vitamin A as a part of their treatment regimen, depending upon the physician's preference. But there are no conclusive evidence from clinical trials to support the efficacy of vitamin A in these cases, preventing blindness. But interestingly, what you notice, 3 of our patients exhibited corneal involvement without concurrent conjunctival inflammation, suggesting that a thorough ocular evaluation should be performed in all measles patients. We know that ocular involvement is a well-documented thing in measles, but this outbreak underscores the critical need for comprehensive epidemiological and laboratory investigation in suspected measles cases regardless of vaccination status. Physician usually manages the eye conditions also. Particular importance is a keratitis because steroid treatment without proper slit lamp evaluation can lead to corneal thinning and increased IOP. So it's essential for ophthalmologists to be actively involved in the care of measles, irrespective of whether cornea involved. In future, such research is needed to better understand the factors contributing to vaccine failure and the ocular manifestations, particularly in adults. And it should also explore the relationship between antibody titers and occurrence of keratitis. So to conclude, there has been a resurgence in measles, which was once thought to be under control, causing a significant public health issue. Despite widespread vaccination, a notable proportion of measles have occurred in individuals who have received a vaccine. Concurrently, a substantial set of these are associated with corneal involvement, presenting a clinical challenge and necessitating a deeper understanding of the underlying mechanism. Thank you.
Very well presented, Dr. Remya. I just want to know what were the total number of patients that you examined and how many patients had any form of ocular involvement amongst those?
Ma'am, we had 30 patients.
30 measles patients.
30 measles patients.
Okay, and out of those?
30 measles, no.
30 with ocular involvement?
Yeah, it means whoever physician has seen the patient with some or the other form of eye involvement has been referred to the ophthalmology department. So I have evaluated all those.
So your study is only on those patients with measles having ocular involvement?
Having some form of ocular discomfort or something.
And you didn't try to find out what is the percentage of the patients presenting with such ocular discomfort amongst the total measles patients?
I have found out only one, means maybe one or two patients more than this. Otherwise, all patients had eye involvement.
All patients had eye
almost
involvement?
all patients had at least conjunctival involvement, and many had a corneal involvement also.
Okay. Yeah. And what was your mode of treatment in these cases?
Most of these patients were treated with lubricants and antibiotic ointment as a prophylactic to prevent the secondary infection. But in severe corneal involvement, we have started steroids in few patients, and all resolved after 1 to 1.5 months.
So did you check the vaccination status of?
Yeah, I have taken the history, but in this we have because the age group is 20 to 40 years, there is a recall bias also, because documented history is not present in all patients, but most of these patients had a vaccination history.
They have taken vaccine.
Yes.
And yet they have...
they took a vaccine, but we had involvement.
Okay.
Thank you, ma'am.